heavy menstrual bleeding, pelvic pressure, abdominal fullness, frequent urination, and fatigue due to anemia, pelvic pain are symptoms that women with fibroids suffer from. So if you have these symptoms and you're diagnosed with uterine fibroids, you might need treatment. Uterine fibroids can be managed medically, surgically, or non-surgically. Once you need a surgical or non-surgical treatment, it is important to be aware of your options. And therefore, today I want to talk about uterine fibroid embolization. Uterine fibroid embolization is a minimally invasive image-guided procedure which is done under fluoroscopic guidance and local anesthesia. It's often a daycare procedure. It does not involve any scars, cuts, or the need for anesthesia or complex surgeries. The procedure is done through a pinhole in the leg or arm, where using image guidance, intervention radiologists go into the blood vessels and access the blood vessels with catheters. And once the catheters are into the uterine artery, we use small particles called embospheres or PVA particles to block the blood supply to the fibroids. Once the fibroids are deprived of its nutrients, they shrink in size over time, and in a year you can expect them to be 80 to 90% of the original size. They often remain as scar tissues within the uterus and do not cause further problems. About 10% of the patients would need a second treatment based on the size of the fibroids. Uterine fibroid embolization has been around for more than 40 years. It's a procedure that is approved by the American College of Gynecologists for fibroid treatment, is associated with low complications and quick recovery. Most patients can get back to their normal activities within a week, and it's a uterine preserving therapy, avoiding the need for hysterectomy or surgical procedures like myomectomy. Hysterectomy is associated with a range of long-term side effects that can be avoided by patients undergoing fibroid embolization. Recent data suggests that women who undergo hysterectomy are at 5 times higher risk of pelvic floor dysfunction or pelvic organ prolapse. As the uterus is a support structure for the pelvic floor, its removal can cause pelvic floor weakness, and post-hysterectomy, many women suffer from bloating. A Mayo Clinic study showed that women who undergo hysterectomy in their 30s can have 3 to 5-fold increase in the risk of heart-related side effects. And these women are also at risk of early menopause because removing the uterus, even with ovarian preservation, reduces the blood supply to the ovary, causing a reduction in ovarian reserve. Uterine fibroid embolization is associated with a lower risk of complications. Patients can often experience pain for about 4 to 5 days. At Rivia, we manage these patients with the help of our pain medicine specialists. Fibroid embolization is associated with the low risk of complications. Usually, most patients only suffer minor complications like post-procedural pain, some mild fever, and complications like infection or need for hysterectomy are extremely rare and happen often in less than 1% of the patients. At Rivia, we have installed the first GE Alia 740 IGS system in India. This system has AI-based dose reduction or auto-write. Using auto-write, the fluoroscopic system adjusts the radiation or X-ray to each patient based on their body and the image settings. This allows us to optimize the amount of X-rays used to image the patient, therefore reducing radiation. The amount of radiation given to a patient during uterine fibroid embolization is extremely low, averaging out to 3 to 4 CT scans. And this amount of radiation is unlikely to cause any serious health-related side effects in their lifetimes for these patients. There's often a misconception that fibroids can turn into cancer. Though they can, The risk of this happening is extremely low, and it is often seen in 1 in 500 to 1 in 1000 patients. Most of these cancers can be picked up while we do the pre-procedural MRI. In the MRI, features of cancer are quite distinguished and can be easily picked up. Up to 80% of the cancers can be identified on the pre-procedural MRI, and therefore the risk of missing a cancer in a patient with uterine fibroids is extremely low. If you suffer from uterine fibroid and are planning to get it treated, please know your options. Get a second opinion on uterine fibroid embolization.